Hello everyone, we're Group 4. Our article was Early Developmental Milestones and Age of Independent Walking in Orphans Compared with Typical Home-Raised Infants. Our group was Caroline Gordy, Hannah Harrison, Kayla Love, Ainsley Pruitt, and Megan Sharp. During the first year of life, children develop most of their gross motor ability. They begin to do things such as roll, sit, crawl, and pull to stand. Each of these motor developments help the infant to walk independently. Children who can perform these motor milestones at an appropriate age will walk earlier than those who do not. The mean age of walking in healthy infants is about 12 months, with a range from 8 to 18 months. Early movement is perceived as necessary for a child's gross motor development. Previous research suggests that infants placed in prone while awake obtained prone-specific motor milestones, such as supported sitting, sitting alone, crawling, and pulling to stand, earlier than those who were placed in supine. Some research also suggests that infant positioning, caregiver handling, and caregiver-infant interaction are contributing factors of early gross motor milestones. Therefore, in orphaned infants that had inappropriate child-to-caregiver ratio, less opportunity to be carried, fewer caregiver-infant interactions, and less free play outside, it was found that they showed delayed motor development. Orphaned infants show delayed walking ability, and their age of walking attainment may relate to early motor milestones while living in orphanages. The purpose of the study conducted by Chibal and colleagues was to determine the early motor development milestones using the Alberta Infant Motor Scale, and to compare the age of walking attainment between orphaned and home-raised infants. For methods, there were 59 home-raised infants and 62 orphans. The home-raised infants had to be healthy, full-term born between 37 to 40 weeks, with a birth weight greater than 2,500 grams, with no risk or diagnosis for delayed motor development, and their study site was at their house. For the orphans, they had the same criteria, plus 3 consecutive months in the orphanage before the study, and their study site was at the orphanage. The Alberta Infant Motor Scale, or AIMS, was used to assess the gross motor development. There were 21 items done in prone, 9 items in supine, 12 sitting, and 16 in standing. If the baby did not cooperate, they could assess and try again later within 5 days. Each observation item was credited 1 point, and any item not observed was credited 0 points. The total score for the 4 different postures was summed up for the gross motor development score. The procedure was non-randomized. The demographic data of the home-raised infants was provided via parents, and orphans was provided via their medical chart. The demographic data included was birth weight, height, head circumference, APGAR score at 5 minutes, gestational age, and method of childbirth. Motor movements were observed using AIMS at 4, 6, and 8 months. Walking determined by date when the baby could walk 2 or 3 steps without support. Then, walking was recorded again when the baby could take 5 steps. Motor development was assessed once in a familiar place where the baby was comfortable, with the baby only wearing a diaper. It was tested for 30 minutes after a meal when the baby was awake, alert, and not crying, and the test lasted for about 20 to 30 minutes. The characteristics from the results of each baby were described using standard deviation and reported by frequency and percentile. A child's independent t-test was used to analyze the difference of the mean score of the AIMS at 4, 6, and 8 months, and at the age of independent walking between orphaned infants and home-raised infants. A child's independent t-test was also used to analyze the difference in the mean age of independent walking between the 2 groups of participants.
The results of the study showed a significant difference in the AIMS scores in age of walking between home-raised and orphaned infants. The numbers shown are the means and standard deviations of the infants' respective AIMS scores where the p-value was calculated. The home-raised infants demonstrated consistently higher scores with an earlier age of walking as compared to orphaned infants. The range of percentile among the AIMS scores ranged from the 25th to greater than 90th percentile for the home-raised infants, whereas the orphaned infants percentile range from less than the 5th percentile up to or greater than the 90th percentile. Walking age also had a significant difference, with home-raised infants averaging walking during the latter part of the 9th month and orphaned infants walking at approximately 15 months.
So there were two main aims of this study. One, to measure early gross motor development of infants in an orphanage compared to home-raised infants, and two, examine the age of walking in orphaned infants compared to home-raised infants. In conclusion, this study shows that orphaned infants have slower gross motor development and therefore start walking independently at a later age of 15 months when compared to home-raised infants that start walking independently at 10 months. The study indicated that further research is needed to look at other factors that might affect developmental delay in orphaned infants. And further research is needed to see if those in early institutional care should receive periodic motor skills assessments to prevent the delay of motor development.
So what does this research look like clinically? As we have learned, so much gross motor development happens in a baby's first year, including the ability to sit, crawl, pull to stand, and walk independently. It is vital that we educate both new mothers and caregivers in modalities such as tummy time and exposing the baby to the upright position, which encourages babies to meet their specific motor milestones. These smaller milestones are what compound to independent walking. This research suggests implementing some type of stimulation program that would boost infants, especially those lacking the traditional family setting, to have more free play and movement. Whether that be scheduled mat or playground time that rotating caregivers could follow, or mandatory time each day that the baby is held upright out of the crib. That added stimulation could help orphaned infants bridge the gap, delaying their gross motor development. Implementing periodic motor skills assessments for infants in local orphanages, providing education to the staff, and following up on babies' development through their first year could be an awesome opportunity to help babies have their best chance at successful motor development. Thank you for your time, and any questions, please just let us know.